It's basically we need to follow the cycle, right? So we need to follow the cycle. You have your period, so that's the early cycle of the period. Then it'll be different from the mid-cycle. So people go like, why are you scanning me over and over? Because different cycles at different phase is different.
Normally, what is the first step? Since we know when this couple should seek for help, right? If they are having regular cycles for a year, I mean, they don't have any other issues and they don't conceive. So this is actually a red flag sign that you should actually start seeking medical attention. So maybe Dr. Natasha, you can share some of your journey also from personal point of view, from medical point of view. The first step for the couples when who want to start the fertility treatment, I mean, what are the things that they would be going through, and how long does it take from the first time that they appear at your clinic and then doing all the tests and also whatever procedures which is necessary and before the initiation of the treatment itself?
Right. Okay, I suppose it varies from where you are for your journey and which facility, medical facilities you are, seeking treatment. Because obviously, when you are in a government setting, it'll be different from the private setting. In the private setting, it'll be different from whether you are seeing a general practitioner, a gynecologist, or you're seeing a fertility specialist. For us, for fertility specialist, time is important. We do not like to delay. We would like to complete all testing within the next 1 to 2 months.
Okay.
So basic testing needs to be a blood test, which will check blood group, make sure there are no sexually transmitted disease, there are no thalassemia, check your rubella status, check your vitamin D level, which is important for egg quality implantation. We then check your hormones, make sure there's no imbalance. Also then that's blood test for both men and female, husband and wife. Then we'd also check for the tubes, right, whether it's blocked or not. So there are several ways in checking for the tubes. And the most important, but not, which we should forget, is the sperm, right? So from the male side, it's actually quite easy because you need just a blood test and a sperm test done within one setting, right? But for the female, it's basically we need to follow the cycle. Right, so we need to follow the cycle. You have your period, so that's the early cycle of the period. Then it'll be different from the mid-cycle. So people go like, why are you scanning me over and over? Because different cycles at different phase is different. Where you are on your second day of your period is different from what the uterus and the ovaries will look like at your mid-cycle. And from cycle to cycle, from this month, January, February, March, it's different. Right, so we're actually monitoring and getting to know and seeing what you do on a normal basis, so we can anticipate how we're going to move forward. Right, so we see lots of things. Sometimes they, would show, okay, this is a scan done by my gynae. I mean, it's not like a chest X-ray, so I will need to scan myself. I mean, I'm happy to see like chest X-rays and things, but for ultrasound, it's better to be doing the ultrasound myself. It depends on when I'm doing it, which cycle, right? So after that's done, I think that's within 1 to 2 months. It should be done. And depending where you want to move forward, depending on the results, you are ready to move towards treatment, which is suitable. And it depends on how fast the couples want to move or where they are. Like, younger couples, we can wait. But sometimes younger couples don't want to wait anyway. So actually, I will have to then depend on the patients, what they want to do. And some couples would want to do things faster. Like they go like, what, IUI, 10-15%, forget about it. I want IVF, I've got, the means, the social means, I've got the money, I want to move fast. So we actually do then recommend accordingly.
All right.
Yeah. So things to anticipate for gynae, we do scans, and majority of the time we do vaginal scan. Right. Then you can only see accurately and clearly the ovaries. So be prepared that we'll do a vaginal scan.